Hello, my name is Janet Lovegrove and I'm here representing Brant Mental Health Solutions, and I have the privilege of introducing you to Allie, who's a death doula. So Allie, we're just curious, what is a death doula and your role?
Yeah, that's a good question. So a death doula is someone who aids in the passing of an individual. So similar to how a birth doula would be advocating and aiding the birthing parent,
Right.
I'm the same thing on the other side. So advocating for the dying person, making sure all of their needs, emotional, spiritual, physical needs are being met.
Right.
Often I am brought in by the family, or sometimes brought in through the medical team.
Right.
That usually happens more in a hospice setting. But yeah, being a link between the family and the medical team, between the dying person, the medical team, the dying person, and their family. And really my role can shift depending on what is needed. So sometimes people bring me on to do more administrative work in terms of MAID. So if someone's wanting to seek medical assistance in dying but aren't really sure how that program works, and it's also changing all the time as well, so there's lots of questions around that, I can help people with that. Sometimes my role is to sit bedside with someone, so that's more being brought on in the imminent stages to help with like the emotional fear of dying. I can also do a lot of more of what I've been doing lately is a lot of planning for people, so making sure that all of their like funeral rites are accounted for, and yeah, making sure all of their like wishes are going to be met after the fact, and that their will and everything is taken care of. So there's really all kinds of things that I can do depending on what is needed, because death is a very multifaceted thing, and the dying experience as well. There's a lot of things that can come up, so just being able to sort of meet people's needs as they're coming about is what a death doula does.
All right. Yeah. So it sounds strong in terms of you're a liaison for the person who is dying and their family or their medical team. Is that fair to be saying?
Yes, yeah. Okay. My primary role is to advocate for the dying person.
Right.
And so sometimes that can get a bit tricky if the dying person has a complicated relationship to their family. If their needs aren't being met by the medical team, I'm there to make sure that all of that is, my primary goal is to make sure that they're getting the dying experience that they want and wish for.
Right.
Yeah.
Right.
But in that process, the family is also taken care of too, because the family doesn't have to worry about wondering what kinds of questions they need to be asking the medical team if they're doing something right or wrong. You know, it's a very traumatic process to witness someone you love dying, and if it's the first time it's happened, you're not going to know necessarily all of the things to ask or to do. And so bringing in a death doula can really just help the family be together and share those last moments in love and peace, rather than like stress and thinking about, oh, I have to like call the funeral director, I have to, you know, ask the doctor this question. So all of that can be offloaded onto me. So there is benefits to the family and friends as well, of course.
Right. And so you hit on something important in that many people are inexperienced with witnessing someone die. And so that idea that you step in and you can educate people in terms of the physicality of dying and what that looks like, but the practical needs, the legal needs, it sounds like you're able to cover holistically.
Yes, yeah, and I think that's a key part, because I think the holistic aspect is something that, you know, I think medical systems do their best to offer that, but it's pretty overloaded system. So of course, not every medical provider can meet the emotional and spiritual needs of a patient, and so having these other roles like a death doula to fill in the gap is important, and especially when someone has different beliefs that maybe can't be met in a hospital or in hospice or whatever.
Can you give an example of that where you have had to help someone with a cultural or spiritual need that wouldn't be met in a
Yeah, for sure. Well, this isn't necessarily, I haven't had too much experience of that in a hospital per se, but someone I was working with a few years ago was in the MAID program, and their best friend, who was their power of care and, you know, link between the medical team and all that kind of stuff, really wasn't okay with their friend receiving MAID because it went against their beliefs. So it's a bit of a difference in that it wasn't the person that wasn't the dying person, but it was their best friend who was advocating for their health. And so my role was kind of to you know, smooth that out between the two, and just, you know, gently remind the person that this is their dying experience, and, you know, that unfortunately, like, this is what their friend, well, fortunately, this is what their friend wants, but unfortunately for her, the friend, that, you know, she would have to put her differences aside and just offer love and support. And, you know, there's work that her and I can do afterwards to talk through that in that difficult process for her. It's tricky because people respond differently, but in that particular situation, it was just a gentle reminder that this dying experience is her friend's dying experience, and any of the conversations that we need to have after can happen after the person has passed.
So you were a strong advocate in that case as well.
Strong in like a gentle way. Yeah,
absolutely.
It didn't really take too much, you know. It didn't take as much effort as maybe it would in other situations, but yeah.
And how does one train or learn to become a death doula? What process is involved?
So there are a bunch of different schools that you can go to that are certificate programs, so you can get like a certificate in end of life doulaship, or they all have different names, end of life contemplative program, or but it's a certification program, and the one that I did was through the Institute of Traditional Medicine, which was, I believe, one of the oldest in the country. And they take you through, you know, the medical part of dying, so you can sort of recognize the imminent symptoms of death and when you need to alert certain authorities and medical staff that this is the situation, this is what's happening, and here are the signs that I've seen. And then they just sort of go through like MAID and just tell you to keep up on that all the time because it's constantly changing, so you have to make sure you're still doing your own research and reading. But there's different modules that go through different aspects of the dying process.
All right.
Yeah.
And what made you decide to become a death doula?
Yeah, so I've had my own experiences witnessing loved ones die, and I've also had my own near-death experience, which was a very life-changing experience for me, and was really interesting because prior to that experience that I had just graduated from university, and I did my major in contemporary dance and a minor in religious studies, and in that area in my minor I was focusing on death and dying in different traditions and how they observe death and dying. So I was really interested in that, and that's when I first heard of a death doula, because it's not a new concept, you know. It exists in the eastern part of the world and for centuries, and the idea of aiding and practicing death is something that is sort of new for us here.
Right.
So I got turned on to that idea in school, and then shortly, months after that I graduated, I had my own near-death experience, and I was like, oh yeah, this is a thing. Maybe I should look into being a death doula because I'm very terrified of my mortality now, and this would be a way of helping me through that. And then after that, then I lost some people in my life, so these, over a very long period of time, things kind of unfolded, and it wasn't until 2021 that I was able to actually become certified.
So it sounds like your own personal life, you had some powerful insights that you obviously now bring to people you're helping transition from living to dying.
Yes, exactly.
All right.
Yeah.
And how would clients get a hold of you and know how to reach you? And where you're servicing.
Yeah, so I do have social media, which
Okay.
some people prefer because it's just a very easy way.
Right.
So my social media is doula_alma, but I have an email, which I prefer. Phone number, of course, is always accessible, and then I do have a website with all of my information, with my email, my phone number, and social media on it.
Okay, all right. Is there anything else you want to tell us about the role of a death doula? And
Just that it's very important, and
Yes.
not to be afraid to reach out for help in this process.
all right, that's wonderful. Thank you.
Thank you.
Appreciate
Thanks so much.
educating us about a death doula role.